parents changed their dog's food 4 times in 6 months and nothing worked. While a vet just said, bland diet and wait and see. Welcome to Unleash Curiosity by Vital Pet Life.
I'm Dr. Amber De Silva, veterinarian and advocate for integrative pet care.
And I'm Donie Yamamoto, founder and CEO of Vital Pet Life. We're so glad you're here.
This is a space where curiosity, compassion, and science converge, where we explore the powerful mind-body connection that supports your pet's health and your own.
Each week, we'll dive deep into the world of pet wellness, breaking down myths, exploring ingredients, and learning from expert voices across the industry.
From nutrition and sustainability to transparency and advocacy, we're here to help you feel more confident, connected, and informed in your care choices.
Let's get into it, because when we know better, we do better. This is Unleashed Curiosity.
Welcome back to Unleashed Curiosity by Vital Pet Life, where we help your furry family members live longer, healthier, happier lives.
Dr. Amber, can you walk through most of the common signs pet parents see and dismiss for our pets? What are common signs that us as pet parents don't really think that it's a very significant telltale signs of our pets health and issues?
Yeah, so it could be loose stools, excessive gas, gurgling, or maybe refusing to eat or eating less. And sometimes owners will think, oh, well, maybe it's just the food. Maybe they have a food allergy or they just don't like this food anymore. And so, that prompts a lot of people to change the diet, but it's not always just the food.
Yeah. For me, pet owners, especially if it's something not in the ordinary, our pets have habits, right? So if the dog or what I notice, if they don't eat, I always wonder if there's something wrong. If, I'm very cautious about it, but is it normal if a dog doesn't really eat the regular, twice a day, or I don't know, some dogs eat once a day?
Yeah, I think that it depends on the dog's lifestyle, personality, breed. So some dogs will do fine with eating once a day. There's certain breeds that are more food motivated that they do better eating twice a day, because just once a day, even if it's the same amount of food, it just seems like only once a day they feel like they're starving and they're going to be begging and they're going to be, searching for other types of food. So, and then there's, in my experience, a really small number of dogs that can actually do well free fed.
Mm-hmm.
Those are typically less food motivated breeds, and maybe they're super active. So they're eating and they just kind of graze throughout the day, but they're active, they're burning it off. But most dogs, if they're free fed, will become overweight or obese.
Gosh.
And so, again, I think it is, I definitely don't want to just say, oh, it's never the food, because obviously that is a concern. Sometimes we do need to make a food change, but sometimes it's inflammation in the gut. Sometimes it's the microbiome, that very diverse bacteria and yeast populations that live inside the intestines that can really be one of the root causes of GI upset, of loose stools, just poor stool quality and underlying inflammation.
Yeah, and I think you can also see that too when, through skin, coat, their energy or changes in their mood, right? And so I think that's something that us pet owners should always be wary about and check. I have another question too. So when my dog gets a yeast infection in his ears every spring, is that a gut thing? Is that a gut issue, or what is it, Dr. Amber?
Yeah. So the most common reason that dogs will get ear infections is allergies. And that's allergies to food, that's allergies to the environment. So it's not specific to one certain thing, but that's the number one cause. Now, but underlying that, we could have an imbalance in the gut. And that causes, there's so many different things that gut imbalance can cause, so many problems with the microbiome. And, that a lot of vets have started recommending probiotics when there's skin infections, yeast infections, signs of allergies, because we need to, sometimes it's an imbalance of the good bacteria, the good yeast in the body that can contribute to skin infections, which we forget to think about that. We're becoming more aware of the microbiome in the gut. I think more people are aware of that, but there's also a microbiome on the skin. We normally, humans and dogs and cats have like normal bacteria and yeast that live on the surface of the body, and that can certainly be out of whack too and cause some problems there.
Yeah. What about those dirty, like, especially with dogs with hair too, right? That's something that the ears, something you had to really make sure that you trim it and because I get that with tuxedo because like, I mean, not much with Martin because the ears is a little bit high and it's open, but
Yeah.
tuxedo really like that's where I mean, I know he doesn't really like it, but we really have to trim it sometimes. That's when we clean it. Can you show me? I mean, I know yeast smells like popcorn, right? That just their foot, right? But but I feel like it's also dirt. Yeah, maybe can you explain it to me more? Make me understand more about it.
Yeah, that's a great question. So, ear infections, the typical signs you'll see are, shaking the head, scratching the ears, sometimes rubbing the ears on the ground or on the couch, just like they're like those ears are really annoying. They're very sensitive. Sometimes they're painful too. And so you can see dogs, scratching and they're kind of whining when they're doing it. Then you flip up the ear or the even dogs that the ears stand up, they can still get infections. So that's kind of a myth that only floppy ear dogs get infections. But when you look, inside the ear flap, it's going to be red. You're going to have a lot of discharge. And sometimes it's like kind of a dark brownish discharge. Sometimes it's a tan color. So those are the signs that you're going to see, and a bad smell too.
Mm, okay.
Yeah, so red, itchy, stinky ears, those are signs of an ear infection. Now, as far as the gut connection, yes, absolutely. The number one reason why we see ear infections in dogs is allergies. So that could be an allergy to the food, an allergy to an environment. Like it's not specific as to, this type of allergy gives a dog an ear infection. It's just allergies in general. Basically, with the allergies, the skin gets inflamed and, the ears are part of the skin. So the skin gets inflamed, the ears get inflamed. Typically what happens is that the microbiome that normally grows on the skin, so certain types of yeast or bacteria, take advantage of that inflammation. And in the ear is a perfect environment. It's dark, it's moist, and especially when you get inflammation, that redness, it gets warm.
Mm.
And it's just sets up a really good environment for that stuff that normally lives there in small numbers to start to overgrow. And then it can progress further on to like more infectious type of bacteria in the ears when it gets more severe. So, allergies is one, but definitely we can see problems. If we're having problems in the gut microbiome, then we can also be having problems on the skin, in the skin microbiome. So, I think we're more aware that there's a lot of different types of bacteria and yeast in the gut, but we also have humans and dogs and cats have a skin microbiome. And so if you have an imbalance in the gut microbiome, you can certainly have an imbalance in the skin microbiome. So I've actually talked to several veterinarians recently that said, as part of their treatment for skin infections, for, ear infections, for allergies, they start a probiotic because we're flooding the gut with good bacteria, good reestablishing a good microbiome in the gut can help us treat and improve those skin symptoms as well.
Wow, so no one even talks about that as a pet parent or the journey of your pet's lifespan, right? I feel like the only time that I got to encounter like probiotic was when he was having diarrhea, but it's not even like ingrained in you. It was more of like, oh, let him take that, but no one really explained to a pet parent that, you know what, it should be something that should be added to his like daily meals or like, diet.
Yeah.
So
Yeah, I think, even in my trained scientific brain, it's kind of weird to think about, I guess it's more obvious to think about a probiotic being used for gut health. And it's not as obvious to think of probiotics being used for skin health and neurologic health and like all of these other things. I think there's a disconnect there. Like we don't really
connected.
fully understand how
Mhm.
many effects the microbiome has on all of the body systems.
Yeah. But that's good to know. I think science, a lot of like studies, I feel it's just recently there's just this like surge of more educational materials that are out, like data studies. So I think it's a good time to be a pet parent, like, having all this. If your dog still has all these issues and you don't know, I mean, there's a lot of information out there.
Yeah. 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 So let's talk a little bit more about the microbiome because that may not be a super familiar term for some people.
Mhm.
So when we're talking about the microbiome, it's the bacteria, the yeast, and some other little critters that, you know, microscopic types of things that live in and on the body. So, like I said, the most obvious place that we think about is the gut. And, back in the day, I used to do, so let's say, and I'm just going to use this to explain what I'm talking about. So, when a dog had diarrhea, I would swab the feces, like take a little swab inside the bum and take a look at that under the microscope. And so for a dog with a good microbiome, you see lots of different types of bacteria, all in about the same numbers. So you have, cocci, which are ball shaped bacteria. You have rods, that are shaped like a rod. You have, lots of different types of bacteria. Now, when I used to do those fecal swabs, which I don't do them anymore in practice, but dogs with an imbalance in their microbiome, you would kind of see like one type of bacteria that have taken over, like instead of being all in about the same numbers, you'd see like one type of bacteria that was, more than 50% of the population. And so that's kind of what we're talking about. If you're looking at it under a microscope, normally there's just lots of different types of bacteria, but then you get an imbalance and there's one or two types that kind of takes over everything. Now, there certainly are like we kind of think about good bacteria, bad bacteria. The quote unquote bad bacteria lives there normally, but if we have enough good bacteria, it's going to keep those numbers in check. And so if we have a healthy, thriving population of good bacteria, then we're going to have less problems with those bad bacteria that if they get overgrown, they can cause some signs of illness. So, if that makes sense, we're talking about the
I get
microbiome
it. Yeah, but how? I
and
mean,
a
we
good
don't.
balance of bacteria and yeast too.
Yeah, but will I know if my dog's microbiome is like good or not? Like just by looking at, or is there like a test for that?
Yeah, I've actually started seeing some tests for microbiome, and honestly, I haven't used them yet. We haven't used them in practice. I've searched, and there are like several different labs that will run like a microbiome scan. Honestly, when I see dogs with diarrhea, obviously we're like digging into the underlying cause. But owners, when they come in with a dog with diarrhea, they're like, just give me something to fix it, because they're sick of cleaning up.
Mm-hmm.
They're sick of washing the dog bed or, being woken up all night because their dog has to go outside. And of course, they're concerned about their dogs. They don't want them to be sick or feeling bad. And so almost always, no matter what the cause is, we'll do a probiotic, we'll do fiber, we'll do a bland diet. And the purpose of the bland diet is it's usually not a long term solution, but it's a short term fix. So when you have inflammation in the gut for whatever reason, it can be more difficult for those dogs to digest their normal diet. And so the bland diet is more digestible and typically has more fiber in it to try to, clear up the diarrhea more quickly, regardless of the cause. So again, like I think because I would say most vets that I've worked with, we will add fiber to firm up those stools. We'll add probiotics anyway to try and replace the gut with good bacteria, if that makes sense. So I think that's mostly why I haven't really done a microbiome screen. But all of that to say, there certainly are some labs that will test the microbiome to look at the diversity and what types of populations are there.
Yeah, okay. But how do we fix this? Especially if nothing has worked so far. Like
Yeah.
how can you, I mean, other than like I mean, there's so many probiotics out there. Like is there like a specific strain, right? Like bacteria?
Yeah.
Yeah.
Yeah. So let's back up just a little bit and talk about what could disrupt the microbiome. So certainly antibiotics. That's kind of what we think about. Number one is, let's say a dog got in a fight with another dog, got a dog bite.
Mm-hmm.
And those are very, very prone to infection, of course, because the mouth is a really dirty place. There's lots of bacteria there. And so, almost always in that situation, we're going to clean up those wounds. If it needs stitches, we're going to treat that wound, but we're also going to put that dog on antibiotics to prevent an infection. So, that's just one example. But so antibiotic use is necessary in some cases for certain things, but we know that it can disrupt and
This, right.
harm the microbiome. Yeah.
What about
So
stress, Dr. Amber, or
for
diet?
sure.
Okay.
Yeah. Yeah. So stress, diet change, any kind of illness, like all of those things, we can get dogs can get their microbiome out of balance. So then what happens is you get inflammation and, there's obviously really important functions that the intestines do. So, your small intestine is absorbing nutrients. That's its main function, not only breaking down things, but absorbing nutrients. And then the large intestine, major function is to remove water from the stool. So if inside the small intestine, it's all liquid. And so when it gets to the large intestine sucks out that water to form normal stools and to save the water inside. So the water gets recirculated into the body. So when we have inflammation in the small intestine or the large intestine, I'm always talking about dogs and cats. They're not absorbing the nutrients like they should. They're not reabsorbing the water like they should. So that's why we see, you know, uh, that's one reason why we can see diarrhea, because the colon, just the large intestine, just isn't doing its job. Now, with that, so you can be feeding a really high quality food that's very nutrient dense, but if the intestines aren't working properly, they're not able to absorb those nutrients. And so the dogs can actually be undernourished. This can also happen in cats. So even though, I have clients say, well, he's eating this really expensive premium food, but if his intestines aren't healthy, then he's probably not reaping all the benefits of that really expensive healthy food.
It has to be a test for that too. Like, how will the pet parent? I mean, other than just like, like there has to be a way. Like, if you like, like maybe to determine, right? That, yeah.
Yeah, that's trickier. I mean, there are some specialized tests for certain types of nutrients. A lot of it is, looking at the symptoms. So you're looking at the quality of the stool. Is the stool normal? Is it watery? Is it a weird color? Does it have mucus? Is it too firm? So the stool quality can tell you a lot about just how healthy the guts are. But you're also looking at the overall appearance. Is the dog or cat in a good body condition? Are they muscly? Is their coat shiny and smooth, or is it dry and flaky. Like all of these things can be clues to tell us if, if nutrients are okay in the body. I tell this, years ago, I had this like kitty mix that came in to check the skin. And it was like the hair was really dull and dry. It was falling out in chunks. The skin was really flaky and red and itchy. And we did blood work on that dog. I did testing to make sure to look for parasites in the skin, to look for infection. And all of these tests were normal, but when I had taken the history, though, the owner said that she was feeding this certain kind of food that was very, very cheap and low quality food. And so after, doing all these tests and finding that no infection, no problems in the organs that I could find. And so I suggested like, let's change his diet and let's just improve the quality of his diet. And didn't really hear back from the owner. And then about a year later, the next appointment, the dog's skin was like perfect and normal. And I was like, oh my gosh, what did you do? And she said, I just changed the diet to a higher quality diet. And so, anyway, I just say that because there sometimes, we go looking for other things when it's a nutritional issue, but it is, again, there's some specialized testing you can do for certain nutrients in the body, but we also want to look at the overall appearance of coat and skin and all of that.
That's a good story, and at the same time, like that's something that we should think of as pet parents and how it can determine what's really going on with our dogs.
Yeah.
So, Dr. Amber, if nothing has worked, like let's just say, like as you said, like there's a lot of like issues other than just like, I mean, how gut basically fixes or connects to a lot of stuff. I mean, to people that have thought about like, okay, I've given them probiotic, what's the difference and nothing has changed? How come nothing has worked so far? What can you say about those? Or how can you tell the pet parent like to look for on the probiotic?
Yeah. Yeah. So there's varying research that shows benefits of both, single strain versus multi-strain probiotics. And I've used both and used both successfully, meaning I saw improvement in my patients. So I think, to answer your question, what if it's not working? Let's change the product and see. I mean, although I'm a huge fan of a lot of, different, like, different types of supplements, and especially with health conditions that we're treating, supporting those naturally with the supplements, some pets just don't respond to the first thing we try. And so I would say if we're already doing probiotics, maybe try a different one. I think also you can have different amount of colonies. So if you look at a probiotic, they're going to have like a CFU count. That means colony forming unit. And so some of them are lower and some of them are really high. So if we have a dog or a cat with a chronic GI issue, and we've been using maybe a lower CFU count, maybe that it needs a lot more. So this even happens in people. If you're using it more for maintenance, then maybe that lower CFU count is okay. It's just kind of keeping everything
Yeah.
normal.
Mm-hmm.
But if you have a really poor microbiome to begin with, then maybe you need a higher CFU count for a longer amount of time to really get those good colonies reestablished, if that makes sense. So if something that you're doing is not working, I think it's worth trying a different product because not all products are the same. Just like in humans, you can look at the shelf and you can look at no matter what kind of product you're talking about, whether it's food or it's a supplement, there's a million options on the shelf. And which one do you choose? And if you choose one, it doesn't automatically mean that one's going to work right away or that it's going to work at all for your individual pet. And so again, I would switch out what you're doing under the supervision of a vet for sure if there's, medical conditions going on.
Yeah, Dr. Amber, what about if a probiotic I'm using, can I share it to my dog? Some pet parents think that, whatever it is that they're taking, they can also share it to their animal. Does that work?
Yeah. I think in some cases maybe. I actually never, and I'm not saying this is bad, because I know a lot of vets recommend it, and I don't think it's bad. But some vets will say, well, just give plain yogurt on the food. Or I think that if we give a species specific probiotic, then we may get better colonization in the gut. So if we're giving a human probiotic to a dog, while it might help, it could also just not actually colonize the gut. So we think we're giving probiotics, but it may not be having the effect that we think it is, because there's a lot that goes on to probiotics, but probiotics have to be given orally. They have to survive the stomach. The stomach is very acidic, and we're not colonizing the stomach. So it has to survive the stomach acid and get into the small intestine and, colonize down into through the small and the large intestine. So I think we have a better chance of that happening. And actually, if we get through, let's say the bacteria survives the stomach and gets down into the small and the large intestine, if we have a species specific probiotic, we know that this species comes from a dog, or that it colonizes a dog's intestine or a cat's intestine, this other species, whatever it may be, then that species will more readily colonize the intestine. If we're giving good bacteria probiotics and it's not colonizing, then it's either being killed or it's being pooped out, and it's not really making any good difference, if that makes sense.
It's
So
useless.
all of those things, all of those things have to happen in order for us to change the microbiome with probiotics. And so more recently, we're realizing that, while yogurt probably doesn't hurt unless they're, sensitive to dairy, but it may not be the best choice for our dogs and cats.
Well, that's a good point for pet parents to especially when you really thought I've been giving Tuxedo yogurt or kefir.
Yeah. Yeah. And again, I don't think it's necessarily wrong for vets to say try yogurt.
And giving a lot of it, because you think that it's good, but you
Yeah.
might be still
Yeah.
useful. I think it's better to have a functional one, that really works. Same goes with us too. You don't want to be eating exactly the same supplement or medicine, and that's not really helping you over time.
Yeah.
Yeah, well, thank you. Next episode, we're getting into what actually works and why the format and formulation matter more than most people realize. Subscribe, don't miss it. And if this episode hits close to home, send it to a fellow dog parent who's stuck in the same loop, and they'll thank you for sharing this episode.
And if you have questions, you know where to find us. We love hearing from you, especially the ones that start with, okay, but why does my dog?
Join us for more science-backed ways to help your pets thrive through our Spotify, Apple Podcasts, and YouTube channel.
And if you have questions or want us to cover a specific longevity topic, send them in at podcast@vitalpetlife.com. We love hearing from you.
This is Unleash Curiosity by Vital Pet Life, helping you protect the pets who trust you most. Until next time, stay curious.